Hi, I'm Kelsey. I'm an RN on the Med-Surg unit caring for Millie Larson, an 84-year-old woman. She was diagnosed with hospital-acquired pneumonia. She's being transferred to special care unit for a higher level of care. She was originally admitted for a UTI and dehydration. Upon assessment, a stage 3 pressure ulcer was then noted, which is MRSA positive and is currently worsening. She's confused and sometimes refuses her medication. She has a Foley catheter because she's incontinent, an IV for fluids and meds. Millie has a soft restraint on so she doesn't remove her IV and has a bed alarm because she's a fall risk. She's not eating or drinking adequate amounts currently. Her vital signs are 98/66, 60 beats per minute, 102 degrees Fahrenheit fever, 26 for her respiratory rate, and her oxygen sat is 90% while on 6 liters nasal cannula. She had complaints of chest pain, rhonchi and scattered crackles were auscultated on assessment. A chest x-ray was then ordered and showed positive for pneumonia. She also has a white blood cell count of 22,000. The provider ordered blood and sputum cultures, and those were obtained. He ordered oxygen on 6 liters high-flow nasal cannula to keep her O2 sats above 92%. That is currently on the patient. He also ordered a normal saline IV solution, 100 milliliters per hour, which is infusing currently. Ciprofloxacin 400 milligrams IV mini bag every 12 hours. We already gave the first dose. Acetaminophen 650 milligrams PO Q6 hours for fevers over 101 degrees Fahrenheit. Toradol 30 milligrams IV as needed every 6 hours for pain. Albuterol respiratory nebulizer treatment every 4 hours and as needed. And respiratory monitoring per acute protocol. She has not had any pain medicine yet, and respiratory treatment was given by the respiratory therapist. Millie's UTI has resolved, but she's still being monitored for eyes and O's per provider order. Her intake is between 300 milliliters with IV fluids, 50 milliliters oral plus sips, and her output is at 200 milliliters with clear yellow urine. The patient has not been very mobile and already had a UTI and MRSA, which was putting her at risk for pneumonia. I think that keeping her while she was immobile in bed was putting her at risk for the pneumonia. I think if she increases her fluid intake and continues with respiratory therapy, she can strengthen her lung function. I do suggest trying to encourage her to take all of her medications and continuing to eat more of her meals. I suggest that we continue monitoring her pressure ulcer so no other infections implicate her pneumonia. And if you have any other questions, you guys can give us a call. Again, we're on the Med-Surg floor, and my name's Kelsey. I'm one of the RNs here. Thank you.